Time for a new pair of boots.
Yep.
You've had a great day. The diving's perfect, and the last thing anyone expects to happen does. Trouble.
It looks like Rick might be in trouble. Why don't you throw him a line? Okay. I need your help.
Someone has to help. What if that someone is you? Do you know what to do? How do you manage an emergency? As a certified PADI rescue diver, you will. Through the PADI Rescue Diver course, you learn diver rescue skills and dive emergency management. You learn to expand your awareness of diver safety, your own and others, so that you increase your skill at preventing accidents as well as handling them. The PADI Rescue Diver course consists of rescue exercises and knowledge development. During the training sessions, you'll complete several rescue exercises that develop your fundamental accident prevention, rescue, and emergency management skills in open water. Your instructor may also have you practice in a pool or confined water. You'll master 10 distinct rescue skills over the course of these exercises. The knowledge development portion teaches you the principles and information you apply in the rescue exercises and scenario. You'll complete these primarily through independent study, either online or with the PADI Rescue Diver video and Rescue Diver manual, followed by brief reviews with your instructor. You earn the PADI Rescue Diver certification after you complete the rescue scenarios. These scenarios present simulated diver emergencies in a typical open water environment. During each, you and your classmates further your training by applying what you've learned to realistic situations presented by your instructor. Don't be surprised if becoming a PADI rescue diver gets you thinking about becoming a PADI dive master. Rescue diver certification means you now pay increasing attention to the safety of other divers as well as your own. That's a mark of leadership and your first step into the upper levels of diving.
Section 1 looks at what causes divers to get in trouble and what you need to consider before trying to help someone. You'll learn about types of stress, how they contribute to dive accidents, and what to do about them. Next, you'll get the basics on first aid kits and oxygen systems, followed by an overview of your possible roles at an accident scene. This section includes the principles and skills you'll practice, including self-rescue and aiding tired and panicked divers. The first step in preventing and handling dive emergencies is understanding what causes them. Though rare, an emergency can arise on a well-planned dive with properly qualified divers due to undiagnosed medical conditions, sudden environmental changes, or other unanticipated variables. But the main reason divers end up needing help is poor judgment, such as diving without proper safety checks, with malfunctioning gear, in poor conditions, or beyond personal limits. Remember that dive planning involves risk assessment. Good judgment avoids accidents, and you need it before a rescue too. When an emergency arises, consider first if you can assist from a safe place. If you must go in the water, consider whether you have the right equipment and the ability, given the situation, to perform the rescue without getting into trouble yourself. Diver emergencies involve stress, a mental and/or physical tension that causes emotional, mental, and physical changes. Stress can be positive or negative, depending upon how the diver reacts to it. Physical stress can result from seasickness, overheating, overexertion, illness, injury, improper gear, and other physical influences. Physical stress doesn't have to be a problem if you exercise good judgment and apply a reasonable solution, like canceling the dive until you feel better. But it can also be a source of psychological stress, which is stress caused by fear. A tired diver may fear not being able to reach the boat in a current, for example. Besides physical stress, psychological stress arises from other factors like task loading, real or imagined fears about the dive, or feeling peer pressured into making a dive the diver doesn't feel good about. In the early stages, you may see stress as a behavior change, such as becoming suddenly sullen or overly talkative. Whether stress leads to a solution or contributes to or causes an emergency depends upon what the diver does with it. When the diver perceives a problem, real or imagined, stress results, with physical and psychological responses. We all tolerate stress to varying degrees. If the diver doesn't recognize the stress or disregards its cause due to something like peer pressure, anxiety rises accompanied by the body's physical responses. These contribute to the stress and add to the cycle. Further events may reinforce the fear and raise stress even more, contributing to the cycle. If this cycle goes unchecked, stress may continue to rise. Mounting stress or a new problem cropping up may overwhelm the diver, resulting in uncontrolled, instinctive behavior. The diver may experience perceptual narrowing and fixate on a single, ineffective solution while overlooking the obvious ones. This irrational, instinctive release is panic, which can be active like this, or less commonly, passive, when the victim essentially freezes into a trance-like state. Without intervention, a panicked diver like this will eventually collapse from exhaustion and probably drown. If the solution works, then stress falls and panic isn't likely. Or if it doesn't work, but the diver stops, thinks, and then continues applying his training and common sense to problem solving, he stays in control, avoids panic, and arrives at a new solution. The ability to stay in control varies with individual characteristics, with training and experience among the most important factors in preventing panic. Now let's look at some of the emergency-specific equipment you'll be using in the PADI Rescue Diver course. You should already be familiar with first aid kits from your emergency first response training. As a rescue diver, plan to have a well-stocked first aid kit on hand when you dive. Along with the items recommended in the PADI Rescue Diver Manual, include a pocket mask in your first aid kit. The pocket mask simplifies making a seal and reduces infection risk when providing rescue breaths. It's also one of the most effective ways to provide rescue breaths in the water. You'll practice in-water rescue breathing with a pocket mask during the rescue exercises. You may also find pocket masks stored with emergency oxygen systems. Research shows that administering oxygen is one of the most important first aid steps for a diver with suspected decompression sickness or lung overexpansion injuries. In this course, you'll practice the basics for supplying emergency oxygen to breathing and non-breathing divers. You'll learn to use non-resuscitator demand valve units like this for breathing divers. These systems deliver 100% oxygen and operate much like your scuba gear. You'll also practice using free-flow oxygen for non-breathing divers or those breathing very weakly. Free-flow oxygen doesn't deliver 100% oxygen and is more wasteful, but it's the only option for someone who's not breathing or breathing weakly. Automated external defibrillators, or AEDs, are devices that analyze a heartbeat and deliver a shock to restore normal heartbeat if needed. As you probably learned in your emergency first response course, AEDs increase the chance of surviving cardiac arrest by minimizing delay in attempts to restart the heart. Depending upon availability and local restrictions, if any, your instructor may include AED practice with your rescue diver training. Let's turn our attention to your roles as a rescue diver with accident management, starting with the terms victim and patient. These have important specific meanings. A victim is someone who needs to be rescued, or who is being helped but is not yet in a secure environment. A patient is someone receiving emergency medical care in a secure environment. A non-breathing diver in the water is a victim. Receiving first aid and CPR out of the water, the same diver is a patient. You'll learn to apply this distinction throughout the course. As a PADI rescue diver, you can make a difference when an accident happens. But your role in managing an emergency will vary. If you're the most trained and qualified diver, chances are you'll take charge and direct the effort. With a more qualified diver like a dive master present, you'll probably function as a skilled assistant. Whatever your role, being prepared personally and with the right equipment makes you more effective as a rescuer. Stay in good health and fitness. Keep your skills sharp and follow safe diving practices. Know where to find the equipment listed in your PADI Rescue Diver Manual and how to use it. Preparation sets the stage for the 6 basic steps of emergency management. You want to be ready to act by anticipating where a problem's likely to occur and thinking about what you would do. If an emergency arises, the first step is to stop and think before you act. Step 2. Act on your plan. If you're the most qualified diver present, the third step is to delegate. Have others assist with the rescue. Contact help. Prepare emergency equipment and so forth within their qualifications. Step 4. Once out of the water, assure first aid, basic life support, emergency oxygen or other appropriate aid for the patient. Depending upon the situation, contact the local emergency medical system and the Divers Alert Network or other local diver emergency system. Steps 5 and 6 may pertain to more serious injuries, with 5 being to coordinate activities and to administrate by gathering information for accident reports, for contacting the patient's family, and to provide to emergency personnel. Step 6 is to arrange for evacuating the patient into emergency medical care, and in the case of a pressure-related injury, assure communication with DAN or other appropriate local diver emergency service. You may have noticed that steps 4, 5, and 6 involve contacting help. A local emergency assistance plan saves time in an emergency by providing contact information for local emergency medical services, police, Coast Guard, or other appropriate services. You should also list the emergency number for DAN, the Divers Alert Network, or other appropriate local diver emergency service. Your instructor will tell you what contact information applies to your area. Now that you know the basics of accident management, let's look at the specific ways for responding to diver emergencies. Starting with how to stay out of trouble yourself and what to do if you have a problem. Remember, you can't help anyone if you're in trouble. You're best able to stay out of trouble or to self-rescue by staying fit and healthy, keeping your skills sharp and diving within your limits, and by having personal emergency equipment like signaling devices. Good buoyancy control saves your energy, and mastering airway control lets you breathe past small amounts of water when dealing with a problem. Periodically practice self-rescue skills like cramp removal, out-of-air ascents, and responding to disorientation, so you're ready to use these skills if you need them. Maintain your gear as the manufacturer recommends and inspect it before diving. Think about potential hazards and avoid them when planning dives. Watch for problems and don't ignore them, even small ones. Many accidents result from when seemingly trivial problems snowball into an emergency. If you have a problem, do what you do when helping someone else. Stop, think, breathe, and then act. Act logically, not instinctively. Make a habit of visualizing possible problems and how to handle them. Now let's look at helping other divers. While it's often obvious when others need help, sometimes it's not. It's important to recognize the subtle signs because they often allow you to intervene before the situation gets dramatically worse. As you recall, stress and anxiety rise before full-blown panic results. If you can spot it and provide assistance, that can end the problem. But scuba equipment and distance can mask the more subtle signs, and a victim may not ask for help. Signs can be subtle or conspicuous. Going from the least serious indicators to most, watch for these surface trouble signs. Signaling for help. Struggling at or below the surface. High treading as if trying to swim out of the water. Rejecting the mask and regulator. Climbing onto anything available to escape the water, and apparent unresponsiveness. You'll learn about helping unresponsive divers later in the course. For now, let's look at the two responsive diver at the surface rescue situations, the tired diver and the panicked diver. A tired diver is a diver with a problem but who is in control. Although we call this victim a tired diver, the actual problem may be cramps, injury, or a problem other than exhaustion. Tired divers often signal for help. They respond to directions if able, keep their mask and regulator in place, and can assist with their own rescue. Panicked divers have lost control and abandoned their training and rational action. They usually reject their gear and fail to establish buoyancy. They don't respond to commands or questions and will attempt to climb on anyone or anything to get out of the water. They will continue to struggle until rescued or exhausted. Handling a panicked diver is one of the most hazardous situations for the rescuer. If the rescuer doesn't use proper techniques and caution, a panicked diver can climb on and overpower him. What starts as an assist for a tired diver can become a panicked diver rescue almost without warning. When someone needs help, your first priority is you. This isn't selfish, but for the victim's sake. If you get in trouble, you can't help. And two victims divide the remaining rescue resources. So think about the most effective way to help while keeping yourself reasonably safe. If you're on a boat or shore, getting in the water should be your last resort. Your first thought should be a non-swimming assist if possible. The simplest is to reach to the victim. Lie down and spread your legs for stability, and reach with one hand so you can't be pulled in yourself. Better yet, extend something to the victim. You can reach farther and let go if the victim starts to pull you in. If the victim's too far to reach, throw flotation and a line. In a pinch, anything with good buoyancy will work. Throw flotation even if you don't have a line, because it may solve the immediate problem while you find another way to reach the victim. If the victim's too far to reach from shore and you have nothing to throw, you may be able to use a wading assist. Go no deeper than chest high and extend something to the victim. If the water is dangerously cold, don't try this unless you're wearing appropriate exposure protection. If you can't reach, throw, or wade to the victim, your next option is to use a boat or other reasonably stable watercraft. Approach from downwind so the boat doesn't blow over the victim, and reach for the victim like you just learned. You'll practice reaching and throwing assists during your training. When a non-swimming assist isn't possible or you're already in the water, you'll use a swimming assist. Although this is the last option, you'll spend the most time practicing these. Let's look at the steps, beginning with how to help tired divers. Swim to the victim with your head up and eyes on the victim so you don't lose track of him. Pace your swim to be fast, but conserve enough energy to handle the assist and help tow him to safety. Stop near but out of the diver's reach. Evaluate his mental state to be sure he's not panicked. Note where his BCD inflator is and tell him to inflate his BCD or drop his weights. If the diver hasn't panicked, be sure you have ample buoyancy and make contact while telling the victim how you're going to help. Provide buoyancy by inflating the victim's BCD or dropping his weights. Reassure the diver with direct eye contact. If conditions allow, have the tired diver take his mask off, lie back, and relax. Help the tired diver reach safety with a tow like the underarm push. Let the diver do as much for himself as possible. In most tired diver rescues, other than dropping weights to establish buoyancy, discarding equipment is a low priority. On the other hand, you may need to help the diver remove gear for a long swim, or most likely, to make it easier to get out of the water. Approach and evaluate a panicked diver exactly the same as a tired diver. Stop and evaluate the diver's state of mind. Tell him to inflate his BCD or drop his weights, and note where his BCD inflator is. Chances are, the diver won't respond to your directions. Assess the diver's strength and size compared to you to determine whether to approach on the surface or underwater. A surface approach is faster, but riskier for the rescuer. The underwater approach is safer for the rescuer, but will take a bit longer. It's the best choice if you're smaller and weaker than the victim. If you decide on a surface approach, begin by establishing substantial positive buoyancy. Try to swim around behind the victim, staying beyond reach.